InspirED Virtual Learning Series. Welcome to InspirED. The InspirED Virtual Learning Series brings you information and resources on a variety of topics to help support learning and successful outcomes for students and families. Whether you're an educator supporting students with disabilities, an administrator providing resources to educators, or a family member, InspirED is for you. The content of this webinar has been pre-recorded, but we want to encourage your participation. If you have any questions or comments, we invite you to be part of the discussion by using the chat feature. Questions will be answered throughout the webinar, and later, we'll be providing a link in the chat to a brief survey. By completing the survey, you'll be able to access a certificate verifying your attendance in this webinar. Connecting and exchanging ideas is key to inspiring success. InspirED was created by the Ohio Department of Education's Office for Exceptional Children and OCALI. Welcome and thanks for joining us.
Hello, everyone. My name is Elizabeth Wheatmartian, and I am with the Lifespans Transition Center here at OCALI. Today, we're going to be talking about a topic that is very near to my heart, supporting the wellness of staff and students. And we are joined by my friend, Kristen Fazio from the Summit Educational Service Center. So I'm going to go ahead and give it to you, Kristen, to take over and kind of talk about yourself.
Sure. Again, I am Kristen Fazio, currently Director of Student Services and Wellness Initiatives at Summit Educational Service Center. Prior to my role, I was a school psychologist. So much like Elizabeth, the well-being of students has always been central to my work and my passion. So I was happy to be asked to provide some information to you today, as we have seen a recent shift in requests that we're getting from districts within our region. Instead of just helping with special education initiatives and supports, we're seeing an overwhelming request for supports to help kids' behavioral and mental health. And I'm here today to share a little bit about some of the adjustments we made, some of the new programs that we're offering at Summit ESC to respond to those needs that we're seeing in the district. Would you like me to go ahead and share now, Elizabeth?
Yeah, thanks so much. I have a couple of questions for you. So for someone who is not familiar with services, can you provide basically a quick overview of who you serve and at what capacity you serve those individuals?
Absolutely. So at Summit ESC, we have 17 districts located within Summit and Portage County that we focus the majority of our services and supports to. However, that's not to say that we can't expand beyond those 17 districts, and we have done so more frequently, especially since the pandemic. One of the things that we found is the virtual platform could be incredibly useful in helping our outreach expand. So I'll talk a little bit about some of the professional development we're offering in the area of wellness. And we've had districts and staff from Columbus, Dayton, Toledo. So our outreach has been great with respect to being able to offer these opportunities virtually. We provide a whole range of services, from your curricular and instruction support out of our C&I department. In my department specifically, that's Student Services and Wellness, we do provide a lot of those related service providers. So we're talking SLPs, school psychologists, audiologists, those types of needs we respond to. And what we've recently added is a whole realm of different service providers who support mental health and wellness. I could talk a little bit about some of the things that we've added. And of course, one of the first things we did to respond to requests we were getting was add social workers and behavioral consultants. We kind of found that in response to the pandemic, with kids re-entering the school system in a full-time capacity, that was a little overwhelming after having such time off and that adjustment period. We've seen an increase in behavior. We've seen some academic regression, social emotional regression. So we've first responded by adding those supports in terms of counselors and behavior consultants that can meet those needs in the classroom head on and provide teachers with some strategies and interventions to help those kids adjust to being back in school.
Wow, that's so great and such a needed service. So I'm so glad that you're doing that. When we're thinking about mental health and well-being, Why do you think it's important that we consider these services for individuals with disabilities? And what are the clear benefits of a student to receive these services?
Sure. When we're focusing specifically on individuals with disabilities, we know that they tend to encounter challenges in general when seeking out effective and accessible mental health care. And this can be attributed to a variety of different factors, including communication barriers, physical limitations. All those types of things make it difficult for them to interact with mental health professionals. And we also know on the flip side that individuals with disabilities do have a propensity for these mental health issues, such as depression and anxiety. Those tend to be some of the more common ones that we see. Therefore, it's critical that they do receive this access to the mental health supports so that these issues can be targeted and addressed to help them essentially be the best versions of themselves and to show up to school ready to learn and equipped with the tools that they need to be successful. The other thing is we're seeing just a whole host of different kind of neurodivergent individuals, such as those with diagnoses of ADHD or autism, that tend to have a high comorbidity with anxiety. And if left untreated, this anxiety tends to manifest as behaviors and aggression because they don't have that self-regulation and control. So we do want to make sure that we're providing them with the resources and supports to address those needs first in the classroom in order just to kind of pave the way for success and be able to have them focus academically.
That's very interesting that you're seeing a rise in that as well. And just kind of, I love that people are starting to refer individuals with disabilities to mental health and wellness services. Sometimes they're overlooked because they don't get that diagnosis. It's not that primary diagnosis, so they don't always seek that treatment. So that's great. What would you say to a caregiver or professional who was maybe hesitant to seek out services or mental health specific services for their child or for their student?
Sure. And unfortunately, we see this a lot. I think first and foremost, the most important thing to do is to kind of find out why they are reluctant to seek out that help and support. It could be a fear factor, just overwhelming, especially for someone who has not had any experience dealing with the realm of mental health. It could also be just because there is still, even though I think it's declining, there's still a certain stigma associated with mental health disabilities. And so kind of talking through some of those things with the parent, with the provider to kind of decrease that fear and erase that stigma. One of the things that we have added at Summit ESC that we found to be incredibly effective and that our districts are embracing is the position of community and family support liaison. And this person works directly with families to kind of help them understand, educate them a little bit on all kinds of different areas of mental health, behavioral health, and help them access those services and support so it's less intimidating for the families. It's been a really effective model.
No, I love that. I think anytime we can make a step easier for caregivers, we're really going in the right direction. And like you said, with that stigma, I hope that that is shifting so that more students and more individuals that need this support are getting connected to services. So thanks for adding that position and making that step a lot easier for families. That means so much to them, I'm sure. When we're looking at evidence-based or promising practices, what are those that, what evidence-based and promising practices are your team using while delivering mental health and wellness services?
Well, sure. One of the things, one effective practice that's actually been around for a while now is just the PBIS framework, the Positive Behavioral Interventions and Supports. This, of course, is an evidence-based tier framework for supporting students' overall behavioral, academic, social, emotional, and mental health. So if this model is implemented with fidelity, we find that it helps to improve social emotional competence, academic success, as well as just improving the overall school climate. So we do have consultants available to kind of work with districts. And if they don't already have a PBIS system or a framework in place, we certainly help them implement that because it is proven to just support teacher and student well-being. And it's a way to create a more positive, predictable, equitable, safe learning environment where everyone thrives. In addition, another thing I think is becoming more and more important, specifically with the older kids in the middle and high school, is just promoting a general mental health literacy through implementation of SEL curriculums, which many of our districts in response to the pandemic have adopted. Some of the more popular ones around our region tend to be the Castle, SOAR, and MooZoom is a virtual platform that has really taken off in our region and seems to have been having some success in terms of addressing SEL. And then just finally, the other thing that I've already discussed but can't emphasize enough is just the importance of high fidelity wraparound services, and that really requires the family engagement, and so that we're getting services not only in the schools addressing those needs, but they're also addressed at home, and they're connected to the resources they need outside of school.
No, that's wonderful that you guys are doing that. And just kind of a follow-up question to that, are your services being offered like one-on-one, or are they group sessions? What does that look like?
That's an excellent question. And it's really both. It depends a lot on the student and kind of what the districts are requesting and where it fits best in. So yeah, just depending on the needs. In terms of like SEL and improving those social skills, which you've seen kind of decline since the pandemic, we are doing lots of group support and getting kids together and kind of doing some modeling. But then there are kids who have kind of maybe more significant needs, that maybe confidentiality is an important component. And so we are certainly having staff work individually with kids as well.
That's great. Thanks so much. And what about if I'm a professional or maybe a parent and I'm seeing my student or my child struggling with what I feel like is a mental health concern, whether that be depression, anxiety, physical aggression, maybe even outbursts, what should be the first approach to helping that young person?
I would say, in my experience, first and foremost, any child that you see struggling in any way, you want to respond with compassion and empathy. You never want to be punitive. You never want to blame. You simply, the first step would be acknowledgement, so that they feel that they can trust you and you build a connection so that you can help them resolve the issue that they share and help them to feel better. Kids with mental health concerns are emotionally vulnerable as it is. So compassion and sensitivity is going to obviously play a key factor in your success. Oftentimes kids aren't acting out due to a lack of control. Sometimes it could be a cry for help. You just want to ensure you're not responding in a punitive manner, which will exacerbate the issues they're dealing with and won't be the help that they're needing.
If I were a teacher, how would I initiate that service? Would I talk to a counselor? Would I talk to the parent? How does that look like?
Sure. In our region, we have a lot of our districts utilizing kind of almost an IAT process that's specific to mental health and well-being. Generally, referrals come from teachers because they're the ones working with the kids, 6 hours a day. They're the ones seeing these nuances and changes in behavior and potential mental health needs. So generally, we have referral forms that districts can use. Some of them have adapted their own, which is also fine. Those usually get placed in the hands of the school counselor or a principal, and then we can kind of begin a session essentially of those folks. We will interlay those who need to be involved, whether it's mental health providers. There are sometimes just instances where some of the issue is related to food insecurities or just not having access to clothing. We notice that a kid's in the same sweatshirt or clothes that he was in on Thursday that since Monday. And so we just insert the right social services agencies, the right people, just based on the presenting need and that referral.
Thank you so much for going over this information today and talking with me. I think you provided such a wealth of information that's so needed across the state and across the nation. Really, mental health and wellness services are, again, something that every child should be able to access if they need it. And I think your services are making that one step easier or one step closer to getting us there. I know that we covered a ton of information today. Would you mind sharing some contact information with our listeners?
Again, my name is Kristen Fazio, and my email is Kristen, KRISTIN, F, as in Fazio, at summitesc.org. We'll also make sure that you have access. You can find a whole listing of some of our services on our website, which is www.summitesc.org. So I'm grateful for the invitation to be here, and I'm hoping that it's helpful information.
Thank you so much again, Kristen, for joining us. If you need anything from the OCALI team, you can reach me at Elizabeth_Wheatmartian, WIET MARSCHEN at OCALI.org. And I will make sure that is put somewhere on a resource page for you because I know that my name is a mouthful. Thank you so much for tuning in today. We're going to be around after to answer some questions, so feel free to put them in the chat and we'll be sure to address those. Thanks again.
Hi, everybody. Thank you so much for coming today. My name is Elizabeth Wheatmartian. If you have any questions about what we've been talking about, please feel free to put those in the chat and we will do our best to answer them. And we are joined with Kristen here. So we are happy to talk about anything that you have burning questions on. But I will go ahead and kick the conversation off. Kristen, what are maybe some helpful tips and tricks that you can share with caregivers or professionals to ensure that they are taking care of their own mental health and wellness? We know that if we're not taking care of our own selves, how can we take care of anybody else? So what are some advice that you would give to parents, caregivers, professionals?
I'm not sure if you're able to hear me, Elizabeth, but I'm having trouble. I'm not able to hear you at the moment. So
oh no.
Oh, okay, it just came back in. I hear you now, but you disappeared. Like your mouth was moving, but no words were coming out for me to hear. Sorry about that.
Hey, no worries. Life happens. We'll just keep moving on. But I was just asking, what are some helpful tips or tricks that you could provide to professionals, caregivers, parents to make sure that they're taking care of their own mental health and well-being? Because if we're not filling ourselves up, we can't fill anybody else up.
Absolutely. I think that's absolutely a true statement and great advice. I think my biggest piece of advice and strongest suggestion would be to not be afraid to ask for help, to be your own advocate. I think if we're talking if it's your child and you have concerns about, I think a first stop would obviously be the teacher. And if that doesn't take things to the level that you want and you're not getting the response, I've also found school counselors these days are very equipped and prepared to help support families with issues that they're having in the home, issues related to behavioral mental health. And the same goes for yourself. Obviously, we can't be a great parent or educator if our own needs aren't met. So I do feel as though there is no shame in asking for help, for acknowledging that there's some more high stressors going on and seeking out that help. We encourage people at every PD that we do to not be afraid, to not see it as a weakness. Actually, I see that as a strength to be able to say, I'm in need of some support right now. And then, being sure that you follow that path to getting it.
Yeah, no, I think that's great advice and something that I do feel like more and more people are more willing to ask for help, especially since the pandemic. I know we kind of touched base on it in our conversation earlier, but I do feel like there is some more awareness and advocacy around mental health, and that stigma is really starting to break down, which I think is really beneficial to everyone, not just the students that we serve, but the people that take care of our students every single day. So I think that's really great advice, to just seek help when you need it and just start asking for it whenever, whoever will listen, just ask. What would you suggest to a caregiver or professional who wants to refer to services, but maybe they don't offer that in their county or their district? Where should they start to look for that help?
Again, I would say the first person that I would seek out in a district level is probably that school counselor, because they are likely connected with the student in some capacity. And most likely, if there is another person in the district, that would be a greater resource. If they do have someone like a social worker or someone who is doing some family engagement, they would probably be the one to know and be able to get that person, connected to the right individual. There's also just the county mental health boards. They themselves may not have direct service providers, but they should have a comprehensive list of services available in the area. Those county mental health boards have been really helpful through this pandemic, since school districts are struggling and grappling with the mental health issues. All of our county mental health boards have been really supportive in helping, get us connected and kind of leading us on how to best serve kids.
No, that's such great advice, and something that I think that is very easy to just like Google really quick to figure out where you can go for that. So I think that's really smart. So thanks for sharing that. Mental health has been a topic that has been on the rise. And I know as a former educator, maybe even 5-10 years ago, we weren't putting as much focus on it or as much training around it. But I do feel like it is coming to the surface a little bit more, and there's going to be more professional development opportunities or trainings. If you were a teacher or someone else in the education field looking for professional development, where would be a good place to look?
Sure. And this is an actual response and one that's going to help plug my organization a little bit. But I feel like though all of the educational service centers, so the ESCs, have done a really wonderful job of responding to the needs that districts are experiencing. They are recognizing fully that teachers are struggling to deal with not only the behaviors and the mental health issues of their students, but also some of them with their own issues due to circumstances brought on by the pandemic and just their own personal stressors. So I think ESCs have developed professional development workshops and trainings to help support teachers in that avenue. We ourselves at Summit ESC offer a student wellness series. And so that's 5 professional development sessions throughout the year that are based on the needs and requests that come from our districts. But we just had one today. Actually, the topic was on human trafficking, and because we're seeing another uptick in that respect and kind of helping equip educators with indicator signs to look for that may suggest students could be involved and to try to kind of intercept and intervene if there's any of those things going on.
Yeah, again, thank you so much for sharing. We haven't had many questions coming in through the chat. So if you could please just take a quick survey. If you're attending, please take the quick survey on today's session and provide us some feedback. And then you'll get your link to your certificate of attendance. If there's any other questions, please feel free to put those in the chat for myself or Kristen to answer. And thank you so much for joining us today.
Thanks for participating in today's webinar. We provided a link in the chat to a brief survey, and we'll also follow up by email with the same link and additional information about this series. This series is for you, and we welcome any feedback. By completing the survey, you'll be able to access a certificate verifying your attendance in this webinar. This recording and related resources will be available on demand through our website, ocali.org. There, you'll also find upcoming and past episodes of InspirED, and you can keep the conversation going on social media. Find us at OCALI Official on Facebook, Instagram, and Twitter, and by using the hashtag InspirEdOhio. As we move forward together in virtual learning, our connections help to inspire success. InspirED Virtual Learning Series.